This lecture is going to cover Chapter 24, Fear and Anxiety Reduction. Now, you may have extrapolated from the title, but this chapter is going to describe and walk us through some of the procedures that are used to help people overcome fear and anxiety-related disorders. Now, these fear and anxiety reducing procedures are based on principles of both operant and respondent conditioning. So the procedures that we talk about end up addressing both types of behaviors, both fear and anxiety type behaviors. I want to start off with just an important acknowledgement here. And this is the fact that learning about anxiety disorders and treatment of them is not a license to diagnose and or treat anxiety disorders. I always include a disclaimer, something like this, when talking to students, especially about different kinds of disorders, because when you're seeing some of these things described, it is very easy to assume that, hey, I tick some of these boxes, I must fall into that diagnosis. So just take this information with a grain of salt and don't automatically assume that you fit into any of these categories and should therefore follow some of these treatment methods. These should always be left to professionals. So maybe you are training to be a clinical psychologist and maybe you will be treating people for anxiety disorders. But leave that until you have all of the training necessary to do so effectively and safely. So that's just my 2 cents here telling you to just keep that in mind. It is interesting to note that some of the relaxation techniques that we're going to talk about today are useful for everyday stress and anxiety relief. So it might be effective to employ some of these techniques, but just be aware of what you're using them for. Okay, so with that disclaimer out of the way, let's move on to actually defining fear and anxiety. So consider a situation in which some stimulus or collection of stimuli elicit an autonomic nervous system response, some kind of increase in arousal. For example, stress. And this leads the individual to engage in some kind of behavior that allows them to escape or avoid the stimulus or stimuli that are leading to those feelings. We can frame this as a respondent behavior that's involving those bodily responses involved in that autonomic arousal. So when you feel that sort of rise in your heart rate or the quickening of your breathing or something like that, that's an increase in autonomic arousal. And I always remember it as autonomic means automatic. These are things that happen sort of without your awareness. So this respondent behavior might mean that you have been classically conditioned to feel those feelings when you are presented with a particular stimulus or set of stimuli. We can then see an operant behavior involved in the escape and avoidance responses when you are feeling those feelings of, say, fear or anxiety that comes from that respondent behavior. So as your heart rate rises, as your breathing quickens, that might lead you to display some operant behavior that you've learned in order to escape and avoid feeling the way that you're feeling. So by that definition, that respondent behavior can function as an establishing operation for the operant behavior. So feeling that kind of stress or anxiety can lead you to displaying those escape and avoidance responses that you've learned through operant conditioning. So from this example, anxiety would act as an establishing operation for escape behavior. If you feel anxious because of a stimulus, you might avoid that stimulus or escape when you see that stimulus. Now, you might have noticed I've kind of been using fear and anxiety pretty much interchangeably. And this is because there is no real meaningful behavioral distinction between fear and anxiety. Some decide to distinguish between the two on the basis of whether a threat is known or not. So you would be afraid of a particular thing, but you would be anxious about things in general. Some researchers will make the distinction that anxiety only reflects that respondent behavior, whereas fear is a combination of respondent and operant behaviors. So if we go back here, they would say that this respondent behavior would just be anxiety, whereas if you have that sort of anxiety plus the operant behavior, then it becomes fear. As we found, a lot of different researchers use different operational definitions for very similar terms. So when you're looking at fear and anxiety research, you would definitely be looking for what each author, what each study has defined fear and anxiety to mean for them. Because a lot of the research uses either overlapping definitions or the same basic definition for either. So yeah, it's kind of muddy. As much as we care, we're going to say that fear and anxiety serve about the same purpose. So that's why we're talking about fear and anxiety behaviors as kind of the same basic thing. So let's apply this idea of respondent behaviors and operant behaviors to a specific situation. We're going to use the example of cynophobia, which is the fear of dogs. So if somebody is afraid of dogs, and anytime they see a dog, they are afraid of them and they want to leave the room, we can break this down into respondent and operant behaviors. Our respondent behavior would be that autonomic response, a rapid heart rate, increased muscle tension, and other things that come from the body, like faster breathing. Maybe they start sweating, things like that. And all of those are elicited automatically by the sight or sounds of a dog. Sometimes even thinking about a dog is enough of a stimulus to elicit these respondent behaviors. Once the individual starts feeling those behaviors, once they have sort of that increased heart rate, they start feeling that fear and or anxiety, they might display some operant behaviors, things like running away from a dog, or they could do an avoidance behavior and avoid going to places where they know dogs might be located. Maybe they don't go to the park because they don't want to see dogs. So that's how we can break this down into those two categories of behaviors. Now, our example of cynophobia would fall under the category of a specific phobia that involves fear and anxiety. And there are tons and tons of sometimes absurdly specific phobias. So you've heard of arachnophobia, maybe even aerophobia, which is the fear of flying. You could have acrophobia, which is very similar to the fear of flying, but it's the fear of heights. So on and so forth. There are so many different something phobias, and those are each specific phobias. We can also see things like separation anxiety disorder, where you have anxiety at the thought of or actually being physically separated from those you are attached to. That would be a big problem in children. Agoraphobia would be a specific phobia, but it's a little bit more complicated than that, I guess. We consider it separately sometimes. Again, it depends on people's definitions, mostly because it's a specific phobia that tends to co-occur with some other disorders. But agoraphobia is mostly thought of as just being the fear of open spaces and leading to people not wanting to leave their homes. But it's actually just a fear of kind of leaving safe spaces. And it co-occurs with usually panic disorders because people who have agoraphobia tend to have panic attacks or similar when they're out in public or when they're in those open spaces. And then it compounds into having a fear of having panic attacks. So they avoid those open spaces because they might lead to panic. So agoraphobia is one of those a little bit more nuanced specific phobias that tends to co-occur with others. We can also have social anxiety disorder, pretty self-explanatory. Generalized anxiety disorder, which is feeling anxious all the time with no particular trigger. I already mentioned panic disorders, obsessive-compulsive disorders, post-traumatic stress or acute stress disorder. Lots and lots of different disorders that can involve fear and anxiety. And Of course, I don't have the time to go into each and every one of these, and this is only a subset of all of the possible disorders that can involve fear and anxiety. I'm just sort of listing the most common ones. There are other classes that go into these specific disorders in far more detail. Something like abnormal psych would probably cover stuff like this. But yeah, just raising awareness before we move on to the actual procedures that might be used to try and treat some of these disorders, specifically by reducing fear and anxiety. The first set of procedures that we're going to talk about fall under the heading of relaxation training. Now, these procedures involve training behaviors that help to produce bodily responses that are incompatible with our autonomic arousal. So things that are going to counteract and make it impossible for all of those sort of ramping up feelings within our body. So things like increased heart rate, things like faster breathing, things like tensed muscles, we're going to be training things that work opposite those behaviors so that we can counteract this autonomic arousal that happens when we're exposed to those stimuli that cause fear and anxiety. Now, as you might imagine, trying to counteract something that your body does naturally is going to take a lot of practice. And I suppose I should specify not necessarily naturally as in it's something innate, it's something that your body is doing automatically after you've learned to acquire that fear. So you're trying to counteract the fact that if you have cynophobia, that when you see a dog, your heart will start beating faster because you've learned that response. It has become conditioned. So we're trying to counteract something that's happening automatically, and that should require practice. Hopefully that makes more sense. As you practice these relaxation training procedures, that feeling of being tense or anxious, those respondent behaviors will come to function as a discriminative stimulus for engaging in these relaxation techniques. And those relaxation techniques will be negatively reinforced by the reduction in that tension. So as time goes on, whenever you start feeling tense and anxious, it should become a cue for you that you should do the behavior. You should do this relaxation type behavior, because if you do those relaxation techniques, you're going to get rid of those bad feelings. So the relaxation techniques are negatively reinforced because you're removing something bad, which makes you feel better. We're going to talk about 3 main types of relaxation training. We're going to look at muscle tension reduction, relaxed breathing, and attention focusing. And each of these is going to get their own slides. So let's start off with muscle tension reduction. And so this can also be called progressive muscle relaxation, PMR. Again, different people call the same basic concept different things. But the idea here is that an individual will practice systematically tensing and then relaxing each of the major muscle groups within their body. So specifically, you have to tense them even more than they already are to then relax them and feel even more relaxed. We'll talk about another process later that also deals with relaxation of muscles, but it's slightly different because it doesn't involve that tensing aspect. But that tensing first and then relaxing is one of the key indicators to let you know that you're looking at progressive muscle relaxation. And this process helps train the discrimination of specific bodily tensions. Basically, it's going to help you figure out which parts of your body tend to tense up when you're showing those autonomic responses. So if you're someone who is afraid of heights and you know that you have to go and have a meeting on the 10th floor of an office building, if you are going through progressive muscle relaxation and you're gradually tensing and relaxing each of the muscles within your body, maybe you notice that you carry a lot of tension in your shoulders. Maybe that's the place where you hold all of your tension for this sort of stress. And then when you notice in the future tension in your shoulders, that could then function as a discriminative stimulus to help you know to go through this process to start relaxing in the future. And as we said, this is training a response that can help alleviate some of that tension and the anxiety associated with it, potentially. But by doing this response, by forcing ourselves to tense and then relax, we can relieve that tension that was there initially because we relax to a state that is more relaxed than we were before we started. And so this process is a skill. It's something that you have to work at. It's just like weightlifting, where you have to get used to and practice tensing specific groups of muscles and then being able to relax them again. And again, this tension reduction can be negatively reinforcing because you are getting rid of muscle tension. And that kind of tension can lead to bad things like muscle pain, strain, leads to headaches, and other problems like that. Some individuals will incorporate things like cue words to try and act as a conditioned stimulus for the removal of tension. They might tell themselves to relax or take a deep breath or something like that, just to try and help make this process work more smoothly. I'm actually going to switch to the next slide where we have a specific set of instructions that come from someone who has been instructing people how to do this PMR, which I always have to check is progressive muscle relaxation. So here they have a list of all of the major muscle groups that we would want to focus on and the exercises that you would use to tense and then relax each of those groups. So you start at 1 with your dominant hand. Make a tight fist with that hand, squeeze really tight, and then release. And so here we have the steps. So tense the muscles, hold, they say specifically for 5 seconds. They also get you to pay attention to that tension. Feel it, notice it, pay attention to it, and then release it. They also bring in the focus on that relaxation that comes afterwards. This is to try and encourage that negative reinforcement aspect where you're focusing on the fact that it now feels better. Notice the pleasant warmth of relaxation. And so they talk about all of these different steps. And so once you've done each of these muscle groups independently, you can also do the whole body and have the same thing. They've incorporated here some of those cue words like relaxing. They've also introduced some deep breathing, which we'll talk about on the next slide as well. And they also bring at the bottom here other things that you should watch out for, things that can serve as discriminative stimuli for the fact that you are tense. So if they get you to notice tension and identify which parts of your body are tense, and then how you might counteract that during your daily life. And some of these would be, instead of having to go through a full session of PMR, maybe you can focus on just that one specific set of muscles that's very tense right now. But this whole process is a good way to become aware of where you're feeling tension and reduce it in order to help alleviate some of the physical responses to fear and anxiety. All right, next we're going to talk about relaxed breathing or diaphragmatic breathing. So diaphragmatic breathing is just a very deep style of breathing that uses your diaphragm rather than just your chest. So this is a focus on deep, slow, rhythmic breathing to produce relaxation. By forcing yourself to breathe slowly and deeply and calmly, you're counteracting your body's natural response to fear and anxiety, which is to breathe very quickly and shallowly to get lots of oxygen in. So you're counteracting that sort of gut response. So here you're using your belly or your diaphragm muscles rather than your chest. So you're going to be breathing deeper, sort of lower down in your core as opposed to up high at your chest. And I already stated this, but yeah, shallow breathing is usually associated with our autonomic arousal. So we're trying to do the opposite. We're doing a particular kind of behavior that counteracts or makes it impossible to do that autonomic response. So you might listen to, say, a recording of somebody guiding you through slow, deep breaths, and they'll say, breathe in for 5 seconds, hold it for 5 seconds and then breathe out for 5 seconds and repeat the cycle. That could be an example of diaphragmatic breathing, and there are lots and lots of apps and videos that can guide you through this process. It is definitely really helpful, and it's a really quick way to not only slow your breathing, but also slow your heart rate because those systems are interconnected. Next, we can look at attention focusing exercises. So we're still under our relaxation training, but this process is going to get us to focus on something other than our anxiety, other than our tension. So we focus on neutral words, images, or tasks to remove our attention and our focus from the anxiety-producing stimuli. Now, you can build these attention focusing exercises into both PMR and diaphragmatic breathing. In fact, get my words together here. By participating in these two exercises, you are directing your focus to something else. For PMR, you're focusing on your muscles and you're focusing on relaxing them. For diaphragmatic breathing, you're focusing on how you're breathing and doing it properly. So by doing either of those tasks, you are actually adjusting your attention. You're changing your focus to something other than the stimuli that are causing your anxiety. This is a really useful way to combat something like a panic attack. So you might have seen posts that advise you to find 5 things that you can see, 4 things that you can feel, 3 things that you can smell, so on and so forth. And that's just an attention focusing exercise. It's getting you to look for different things that you can see, focus on things you can smell, that you can touch, that you can taste, so on and so forth. So by looking for other things, by distracting your brain, you stop paying attention to the stimuli that are producing this anxiety, and it allows you to calm your nervous system. Other examples would be something like guided imagery. So if you've ever listened to a meditation CD and they say, close your eyes and imagine that you're on a beach, that would be an attention focusing exercise. Meditation itself can be an attention focusing exercise. If they direct you to focus on your breathing or your posture or whatever. Hypnosis could be the same, even something like yoga. If you're focusing on something other than what's causing you that anxiety, it serves as an attention focusing exercise. Next, we're going to talk about behavioral relaxation training. Now, this is the one that I told you that is similar to our progressive muscle relaxation, but behavioral relaxation doesn't involve that aspect of tensing first. And so this one's a little bit weird because the title of it doesn't really give us a great clue as to what the process involves, but it basically gets you to assume some kind of relaxed posture, and basically get all of your major muscle groups to relax. So you don't tense first, we're just relaxing. So what they're basically doing is training the client to behave as though they were relaxed. So they would say something like soften or relax your head. Relax your face, your mouth, your eyes, your shoulders, your hands. And so they could focus on different parts of the body and tell you to relax each of those. Again, this exercise is going to be a skill that needs to be learned, and it can be learned using prompts and reinforcement. So you could be prompted to relax your head, your eyes, your mouth, and so on. And each time you do it, the person who's guiding you through that relaxation process might say, good, now let's move on to the next, or something like that to let you know that you're doing it right. You can also be guided to sort of focus on your own body and sort of notice the tension in your hands, relax your hands, notice the tension is gone. So a lot of these different processes can kind of cross over and be used together in conjunction. So lots of our relaxation trainings can be used all together, but we focused on each of them individually so that we can look at sort of the definitions of each component. All right, for the next couple of slides, we're going to focus on desensitization. So the logic that is behind our desensitization processes is based on the idea that fear and anxiety are learned respondent behaviors, basically saying that fear and anxiety have been classically conditioned. So desensitization is effectively going through extinction. So let's go back to our example of someone who's afraid of dogs. We would start with a neutral stimulus, a dog. And over time, through pairing with an unconditioned stimulus, something that happens naturally, maybe the parent is afraid of dogs, or maybe the child gets bit by a dog and then they feel pain or something like that. Over the time, that pairing of a neutral stimulus of the dog and something else that they're observing that is going to lead them to feel that fear, having that unconditioned response, will lead that previously neutral stimulus to become a conditioned stimulus. So over time, they learn to have a fearful reaction, a conditioned response to that conditioned stimulus, to seeing a dog. So over here, the fearful reaction came from, in this example here, the fact that the parents were afraid of dogs. So the dog is present, the parents are afraid, so the child feels fear. Over time, seeing the dog by themselves leads the child to feel fear. This would be the normal process of classical conditioning. This is a normal acquisition of an association between that conditioned stimulus and that conditioned response. So, as I said, desensitization is effectively extinction. So, for classical conditioning, extinction is the repeated presentation of our conditioned stimulus in the absence of our unconditioned stimulus. So, have the child sit in a room with their parents and the dog where they are not afraid, where the parents don't act afraid. Show the child that the parents don't have a fear response, so the child shouldn't have the fear response either. If the unconditioned stimulus was pain from being bit by a dog or something like that, then you can have them sit in a room with a dog where the dog doesn't touch them, doesn't interact with them, and therefore there is no unconditioned stimulus. So that repeated presentation of a conditioned stimulus with no unconditioned stimulus present will lead to that conditioned stimulus losing its ability to elicit a conditioned response. Basically, the more you're around the dog and you aren't sort of forced to feel that fearful feeling, the less you're going to be afraid of that dog. And now we're going to talk about a couple of different types of desensitization, starting with systematic desensitization. So, systematic desensitization is going to replace anxiety using relaxation techniques as the person imagines the fearful situation. So instead of having you sit in a room with an actual dog, they would have you imagine being in the room with the dog. So they would start by setting up a hierarchy of fear-producing stimuli, which we will cover on the next slide. Actually, no, let's hop to the next slide and then we'll come back. That's probably the best way to do this. So you want to create a hierarchy of these fear-producing situations. So the items in your hierarchy are ordered from least to most fear-producing. So maybe you would start low on the list of saying, I'm afraid of dogs. And so a low-level fear would be, I'm on the other side of a park from a dog. That's a little bit scary, but not too bad. Maybe something that's higher on that hierarchy, something that's more fear-inducing, would be having to be in the same room as a dog. The dog is a lot closer now. Maybe next thing on the list is I would hate to have to sit next to a dog, or I would hate to have to touch a dog, or something like this. So you can make a list of these items, and you want a list that goes from sort of very low on the fear-producing side of the scale up to very, very scary on that scale. And so this This process involves the use of subjective units of discomfort. This is a SUDS rating, where if something is very low on the fear scale, then it would be like sort of low on that SUDS rating. So 10 would be a fairly low SUDS scale. Or SUDS rating, and 100 would be the maximum on that SUDS rating. So having to touch a dog as someone who is afraid of dogs would be a 100. And then maybe just having to be on the opposite side of a park from a dog would be, say, a 10. And so this is a very subjective thing. As stated in the name, it's subjective because each individual determines how afraid they are of each of those concepts. So you decide what counts as a low level fear for you. You decide what counts as a moderate level of fear, a high level of fear, and so on. So you create your own rating, you create your own hierarchy. And that's sort of the first step of this systematic desensitization. So we can come back to our previous slide where we're going to actually gradually move through that hierarchy of fear-producing stimuli, and we're going to relax at each of those steps. So you start at the very bottom, at the very least scary idea. So you say, okay, it would be a little bit scary, but not too bad to imagine myself on the opposite side of a park from a dog. So the therapist would have you think about that situation, and they would say, while you think about that, focus on your breathing. Take a deep breath. We can use our steps back here, our relaxation training steps. Any of those could be used to reduce that autonomic response from our nervous system. So by forcing that relaxation, we're having exposure to our conditioned stimulus, the thought of the scary thing, without having that fear response, without having our conditioned response. And so as you are able to tolerate the not so scary things, you'd move up to the more and more scary things, eventually working your way to the very top of the hierarchy and getting to the point where you're imagining, say, sitting right next to a dog or petting a dog. You're still going to be focusing on your breathing, you're still going to be relaxing your muscles, but you're also imagining touching a dog, interacting with the dog. And by reducing that fear, by having that extinction process happening, it should help you reduce that fear overall. Now, you keep in mind that with systematic desensitization, we're only focusing on imagery. So you're imagining being in the room with the dog, touching a dog, but there isn't an actual dog in this situation. The hope is that this relaxation would generalize to the actual fear in the real world. And that isn't always the case. So sometimes systematic desensitization is best used as a precursor to the next kind of desensitization that we're going to talk about, which is in vivo desensitization. So in vivo just means in the real world. So in vivo desensitization is basically the same as systematic desensitization, but with non-imagined stimuli. Basically with real stimuli. So instead of imagining a dog, you would actually interact with a dog. And so you still do the process of maintaining relaxation while working your way up a hierarchy of more and more fear-inducing settings. So the example at the bottom here would be if somebody's afraid of snakes. So something that is low on their SUDS ranking would be a cartoon of a snake. It's not a real snake. So maybe you could look at a cartoon of a snake and relax. Then you would look at a snake that's in an enclosure, so you know that you're safe from that snake, and you can just see it on the other side of the room, inside its enclosure. Maybe then you have somebody else hold the snake near you, and then maybe you hold the snake yourself. But again, we're working through that hierarchy. We're getting to more and more fear-inducing situations, but we're focusing on that relaxation, and we're only moving at a pace where you only advance once that individual is relaxed and comfortable at the stage that they're at. You don't move on to a more fear-inducing scenario until you're comfortable at the stage that you're at. And this might also involve another technique called contact desensitization. So you could have your therapist or the individual that's guiding you through the desensitization process reassuringly applying physical contact, something like holding your hand or putting an arm over your shoulders or a hand on your back, something that lets you know that you're not alone, that someone is there with you, and that you are safe. So that's a process that tends to go along really well with different desensitization techniques. More recently, we're starting to see the use of virtual reality. And this is one of those things where, since the textbook has been written, virtual reality treatments have become more and more effective. But the use of VR and other technologies is actually making desensitization a lot more realistic and practical in a controlled manner. So it used to be if someone was afraid of heights that you'd have to take them out and bring them somewhere that's up really high. But nowadays, you can just have a virtual reality headset and show them a video game where they're standing at the top of a building, or show them a video of the top of a cliff and have them look around and interact with it. So having virtual reality can actually allow you to expose people to situations like that so that they can be exposed to the conditioned stimulus, but they know that they're safe, there's no risk of falling, there's no danger. And so they can start to feel relaxed in those scenarios. The textbook notes that the upfront cost for hardware and software can be quite prohibitive, but they mention that it's rapidly becoming cheaper and more cost effective, and that is absolutely the case. It's getting to the point where it's not unlikely or not impossible to get a headset for under $500. You can have a full VR headset setup for a few $100s, which is fairly reasonable when it comes to lab space and setup. So virtual reality, I believe, is probably going to become a more and more prominent aspect of desensitization as time goes on. The next technique is actually a fairly controversial one, and this is the idea of flooding. So if our desensitization is similar to extinction, if I can remember my words, flooding would be a lot more like habituation. So flooding is the idea of having a client exposed to the feared stimulus at full intensity for as long as it takes for them to stop being afraid of it. So whereas our desensitization would have somebody who's afraid of snakes sort of gradually get closer and closer to a real snake until they touch it, flooding would be starting off by putting the person in the room with a bunch of snakes. So this, as I said, is a very controversial technique. It's very rarely used with intense phobias. It would be used with things that are a lot less intense, things that can't be directly harmful. But it can be effective when used correctly. So maybe you have a fear of public speaking, and then you have a course that makes you give a presentation. So you have to stand up and give a presentation. And then in your next class, you also have to give a presentation. And the next, and the next. And all of a sudden, you don't mind presenting. Honestly, that is fairly similar to how I became a lecturer. When I was in undergrad, I was the kind of person who used to throw up before having to give a presentation, before having to speak in front of a group. And nowadays, I can give a lecture in front of a few hundred students and not really bat an eye. And it's because I was forced to give many, 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 many presentations throughout my undergrad until I stopped being afraid of it. So flooding can be an effective technique, but there are some things to keep in mind. Of course, there are the ethical concerns. Is it ethical to force someone to face an intense fear? Is the benefit of overcoming this fear going to outweigh the sort of physical discomfort that they're going to face while experiencing it? You also have to keep in mind escape responses. Our natural response to being put in a fearful situation is to try and escape or avoid that situation. So people might try and run away. And that can be dangerous, especially if you're in a situation where maybe they're around a stimulus that could be harmful. If they're going to respond unpredictably, then it can cause more harm than good. And if individuals are allowed to escape from those frightening situations, that might actually make their fear worse. So, flooding is one of those techniques that is only used very rarely when it is deemed necessary and should only ever be conducted by a highly trained professional who is very, very well trained and skilled in this process. It can also lead to medical complications if someone is forced to face their fear for too long, and if it's too intense for them, or if it's done incorrectly, their heart rate could rise alarmingly. It can cause a full-blown panic attack. It can lead to things like heart attacks, hyperventilating, and so on and so forth. So this is one of those that it's falling out of use and is very rarely seen nowadays, but it is important to note. And our last technique is modeling. And this is an interesting one because we rely on the fact that people tend to feel more comfortable and more relaxed if they can observe other people not being afraid of a situation. So you can have a client observe a model going through the behavior that you're afraid of. So if you're afraid of public speaking, then maybe you watch a lot of people speak publicly. The example here, they have a child who was afraid of surgery, so they had them watch other children getting wheeled off to surgery and not being afraid of it. And this is a really interesting process because modeling can happen either live or through video. So it isn't just sort of an in-person phenomenon. It can also happen if you see people through video as well. So it's a really useful way, especially for children, by having them watch, say, their parents or caregivers go through an action, then they're more likely to go through that action themselves without being afraid. All right, so for our wrap up for this chapter, we're going to hit some notes about desensitization. So hopefully by now you've realized that desensitization is usually fairly effective, and it's useful for more than just phobias. We've talked about it in terms of mostly just specific phobias, but it can also be useful for things like OCD, PTSD, social anxiety, and more. It can be a highly effective and also versatile procedure, but we should keep in mind that it can be a slow process. It involves learning to replace a conditioned behavior with something else, and sometimes those fears are very deeply rooted, so it can take a long time to counteract those. Especially if we do something like systematic desensitization, there are lots of steps involved, and it can be a lengthy, time-consuming, and resource-intensive process. We can, of course, combine this systematic desensitization or any kind of desensitization with any of the other techniques that we've talked about throughout this course. Things like reinforcing positive behaviors, like approaching something that you're afraid of, could also help to make that process go faster. So when someone's afraid of something, they're more likely to run away. But if you reinforce that approach behavior, then you can help them get closer to it faster. You can help reduce that avoidance responding, because avoidance responding tends to come from that fear response. So when you're afraid, you want to run away. If we can reduce that fear, then they're less likely to run away. We do need to consider spontaneous recovery and the fact that what we learn in a therapeutic setting might not generalize to other contexts or other stimuli. So we need to be careful about those things as well when we're going through this training.